Hi, you're watching In Focus with Hindustan Times. I'm Aditi Prasad. Now, doctors have rightfully been in the spotlight of public gratitude and respect during this unprecedented, once in a century health crisis that we seem to be facing. Nurses, however, have remained relatively unsung. They serve a critical link in the healthcare system of not only nursing people back to health, but also they are the big support to the family of the sick. And they do this often wearing those suffocating PPE kits that you see on your television screens while in COVID wards, caring about positive patients even at the risk of exposing themselves and their families to the virus. This show is about them. In fact, all our guests on the show today have themselves been infected with the virus in the course of their duty and have recovered, thankfully. And today, we hope to listen to their stories and experiences during this pandemic. Joining us on the show today is our two very experienced nurses. I'm joined by Neha Saini of Umkal Hospital in Gurgaon, and I am joined by BIBINS Baby from the Rainbow Hospital in the national capital, which is Delhi. BIBINS, let me start with you. Tell us what it is like working in these COVID wards. What is the emotional and mental stress like?
So once you have chose the profession like nursing, you have no other option that it is your passion. And the crisis, you can't be sitting in your home and you can telling anyone that I will be away from this pandemic. So this was a scenario which we have faced. We have heard about a lot of people that people are dying, that people are suffering from COVID. But once we get COVID in Delhi, the private season has been the COVID patients are number of patients are too high. The government has asked us to take COVID patients. Most of the nurses are from south and even from the northeast. So everybody, their parents are asking them to come back, but many of them left the job. So the number of nurses working in the organization was too less. That was one of the crises which we faced.
The capital was facing a crisis of hospital beds, of ICU beds, of oxygen, medicines. Neha, tell us your experience of the first surge versus the second surge.
Yeah, I sometimes I feel very grateful because at the at the time of the crisis, so we help a lot of people in the that time. But sometimes I'm very worried because at the time of COVID, we also wear a lot of COVID PP. So it is very difficult for nursing staff and also doctors because in the PP at the time the hot uh, weather is changed, so all the time sweatings and shield is very not in comfortable
Huh.
face shield.
Hmm.
So a lot of issues in at that time, but it's okay. We manage all the things.
आपको फिर भी अपना काम करना है इसके बावजूद
Yeah,
कि
yeah.
आप घर पे अपने यू नो आपको बहुत ज्यादा केयरफुल रहना पड़ेगा कि आपसे आपके घर वालों को ना हो जाए
Yes, yes,
क्या
of course.
वो आपने पूरी केयरफुल वो आप रह पाई आपके किसी और फैमिली मेंबर को नहीं हुआ
नो 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 मैं तो खुद सिंगल उसमें रूम में रह रही हूँ बिकॉज आई एम मतलब कि मुझे नहीं लगता कि किसी और को मतलब मैं अगर infected हूँ, कोई और इन्फेक्टेड होता है मेरे से, तो इसलिए मुझे खुद को क्वारंटीन करा है, मैं खुद सेपरेट रहती हूँ जब तक कोविड में ड्यूटी है बिकॉज
ओके
हम लोग ऐसे ये वाला केयरलेस करेंगे ना कि अगर मुझे मतलब मैं कोविड में ड्यूटी कर रही हूँ, मैं जा रही हूँ, मैं किसी और को इन्फेक्टेड कर रही हूँ, तो ऐसे ये फैलता जाएगा, स्प्रेड होता जाएगा, इसको हम कंट्रोल नहीं कर पाएंगे. सो ये मतलब हमारी रिस्पॉन्सिबिलिटी है कि हम इसको कैसे स्प्रेड होने से कंट्रोल करेंगे.
दैट्स वेरी नाइस तो आपने ये बिबिन्स आप भी अपने घर वालों से दूर रहते हैं बिकॉज आप कोविड ड्यूटी पे हैं या आप इतना ज्यादा आपको वार्ड में जाना नहीं होता कोविड वार्ड में
So I'm basically
कोविड
from
में
the south.
ड्यूटी है अभी.
I'm 300 kilometers, 3,000 kilometers away from my family. So I'm staying
ओके
alone with now these days. My wife is there.
व्हाट हैज बीन द मोस्ट हैरोइंग एक्सपीरियंस ये जो पिछले एक डेढ़ महीने में जो हाल हुआ है दिल्ली में जो भीड़ लगी है अस्पतालों में, और जो आप लोगों को सहना पड़ा है, उसके बारे में बताइए। आपका क्या एक्सपीरियंस रहा और उस एक्सपीरियंस की से क्या कुछ लर्निंग मिली है आपको?
This has been the first time in last 15 years of my experience of a nursing career I faced like the crisis. The entire hospitals in Delhi is getting completely full. There are no beds available. Even our neighbors, where we are staying, our neighbors who got positive, they are running all over the Delhi to get a single bed. जहाँ पे ऑक्सीजन दे सकते हैं पेशेंट को. That was too difficult for us to manage. So we tried even the pay. See, you can understand Madhugar Rainbow Children's Hospital is a pediatric and gynecology hospital. Every
जी,
single parent, they take their children to the hospital with a hope that they will be recovered, they will be treated well. We had a good team of doctors. They tried their best. In spite of that, once when we find there is one or two death which is there due to the COVID, that makes
हम्म,
us two times too worried because we have a children in our home, we have our parents in our home. We are all worried about all this.